chelo ate o makiyayo wane wachelo ate o makiyayo wane wachelo ate o makiyayo we are no hene ate no mechiho we are no hene Ashiya che 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 lo wane wachiye ate omakiyayo wane wachiye ate omakiyayo wane wachiye ate yano hainiyo Which your name, which your name, which your name, which your
And why do we do it? Yes, we get to see different areas, and that's always interesting. But if you can help one person along in this life to have a better life and to think differently, you have fulfilled the reason why God put you on this earth. And even if it's only one in your life, and you may never know, but it is true. You plant the seed, others water, but the fruit is when they grow up and pass that along to someone else.
Oshemalayo, wane wachiye yano aineyo wakata kaya Oshemalayo, 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 wane wachiye yano aineyo
I think it's great. One thing we notice is, they might not have everything they'll have all the resources maybe we would have back home, but they definitely notice that they're just very appreciative of what they have. They're usually really happy. Little kids totally, they love seeing people. They don't care who's coming to see them. They think it's fun, like to ask questions and learn how to do things. And what are we doing to them, and take blood pressures. And, yeah.
Which your name, 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 chokoki, hello, no, watching,
Me and Abby were talking about last night, which kind of confirms that we're moving into our nurse role, was that even though we had set jobs such as like vital signs, heights, and weights, and the provider did all the assessments, Abby said that she found herself looking at everyone's skin when she was doing blood pressures, and I found myself looking at different things with the kids, asking them different questions, and even finding head lice just by observing and assessing.
So going off of what Leigh said about assessing, we were kind of doing assessments as we drove to Pine Ridge Reservation, just like looking at the community around us, and there wasn't really much. It's literally just all fields, hay, cattle, and it kind of just gives us a perspective on what they have, so then when we as nurses or nursing students are assessing the children, then we can kind of know what resources they have, so that we can kind of put ourselves in their shoes.
So every time we ended up going to a school, they were always so grateful that we were there. By the end, they're definitely smiling, and they're like, we want you back next year. And it really just shows that they truly are grateful for what we're doing and for the time that we're putting in it is really hard for a lot of the students to be able to get the care that they need just because the land is so rural and there's only 2 clinics on the reservation and then 1 large hospital off the reservation. So it really is important that we are able to spend our time helping and volunteering with these students, and we're learning so much while we're doing it.
The stuff we learn in school is who we are and a way of life. It's not just like our skills that we learn in school and our personal and our life skills. I think it's all connected, and I think it's a really good experience to get that connection and know that you are a nurse like all the time. It's not just when you're in school and you're learning.
A lot of Native American populations and different tribes have higher amounts of astigmatism, which is a type of glasses prescription, and that was even reflected. We saw that today in a lot of the kids that we saw. Kids, when we're young, you know, we don't. If our vision is blurry, we wouldn't really know that that was abnormal because it's just what we're born with. So oftentimes we need to start screening in some way what kids' vision would be like, or what kind of glasses prescription they have at an early age, to try and catch kids early on so that they develop normal vision. We really need to be able to kind of catch these kids, and then we can refer them to some of the local providers who can hopefully prescribe them glasses and get them in the correction that they need so they can start seeing the things that they may have been missing out on, and continue to develop normally and do well as they progress through childhood and school.
I came here before my senior year of high school, and this is where I realized that I wanted to become a nurse and work with the underserved population and underdeveloped population, and I've just fell in love even more the past couple of days that we've been here. I've gotten better at my communication skills, just with like my nursing skills in general, so I'm just really grateful that I have this opportunity.
Getting to work with Sig and Jean Gunderson the last few days has been just a really great experience. Jean Ann's just she's not in the medical profession, but she just gets her hands in wherever help is needed, and she's right with us with all the kids. And just hearing her speak to me yesterday about like why she does what she does and why she feels it's so important, it's just like made me tear up.
So what was really cool was that the first day I got to jump in on assessing 2 infants, which is like my cup of tea. I love that so much. And I think from that very first day, and especially all through the week, I can probably speak for all of us in that we've grown so much in our practice and like getting experience, and it's so much more than just observing or learning with a preceptor right by your side the whole time. We've actually been able to do most of the work ourselves and being able to assess and find relationships with these kids is just the best part of it. I love that part, and I think it'll be really good as we go into our future jobs because we'll have this experience to look back on and learn from.
One thing that I found that was really, really great about this trip is that even though we're in a land of like, there's not much, there's really not many stores, there's not many restaurants, and not many schools in general, that you can feel so full. And I think it just comes down to the people that you're with and how the connection here is so prevalent, and their tradition and their ability to go back and remember the history. I think that is what really brought this trip to life.
Students instructor, I have seen such growth in these students. They came here kind of nervous and wondering what's going to happen, and now they're assessing babies. They're finding all kinds of things in their assessments. They're getting attached to these kids, they're hugging them and they're getting very close to the culture and to the people. And it's just a wonderful thing to see in these young ladies as they grow in their nursing career.
We're